my name is Madeline. I'm a student nurse from Purdue University Northwest. I'm just going to be following around your current nurse today and providing you additional care if you need any. So I just want to verify that I have the right patient by seeing your name band and verifying your name and date of birth. Okay, great. And I see that you're not wearing an allergy band. Are you allergic to anything that you know, whether it be medication, seasonal allergies, food, or even any thing in the environment? Oh, okay, great. So I've already performed hand hygiene. I don't need any personal protective equipment because the door did not say that I did, and I looked in the chart, didn't say that I did either. So I've identified the patient. Everything that I need here is at my bedside, and then I have my curtains closed, the door closed to ensure that my patient has some privacy. So I'm going to assess the patient and see if there's any need for a non-pharmacologic pain-reducing intervention or any medication before changing the wound care. So I would administer the medication and allow time to make sure that the medication has taken effect before I would do the wound care. We already did that about an hour ago. My patient has stated that they're feeling comfortable, so now we're going to continue. So now my waist receptacle is at my side here, so it's an easy access to me. And my bed is already at a comfortable height, so it's at elbow height. We're going to pretend that it's at elbow height. And it's comfortable for the patient as well because I can easily access the patient. So they're comfortable where they're at right now. The wound is on their foot, so they can be covered, which is nice, which tends to make them a little more comfortable, and I want to make sure that my patient is staying warm on this chilly day. So I'm checking the position of the drains, the tubes, and other equipment before removing the dressing, and I'm going to put on a clean disposable gloves first before I do anything. And I'm going to loosen the tape on the old dressing here on his foot. And then if necessary, I'm going to use an adhesive remover to help get the tape off because it can be a little sticky and adhere to their skin. So now I'm going to carefully remove the solid dressing here. If there's any resistance, I'm going to use a silicone-based adhesive remover to help remove the tape. If any part of the dressing sticks to the underlying skin, I'm going to use small amounts of sterile saline to help loosen and remove it. So now after removing the dressing, I'm going to look at the wound. I'm going to see if there's any presence of odor, drainage, discharge, any redness or swelling, things like that. And I'm going to place soil dressings in the appropriate waste receptacle, which is right here on my right hand side. And then I'm going to remove my gloves and dispose them in the appropriate waste receptacle as well. And I would pretend that I'm balling these up here, but I'm about to use them again. So I'm going to put those to the side. So next I am going to inspect the wound site for size, appearance, and drainage, just like I said earlier. Assess if there's any pain present. Are you feeling any pain right now? No, you're comfortable, so medication must be working. So I'm going to check the status of the sutures here. I'm assuming I have gloves on. And then look at the closure strips, staples, and drains or tubes if he has any present. So he just has he has a few sutures down his foot right there. And so they do look great. So I'm not going to do anything to them at this moment. So using sterile technique, I'm going to prepare a sterile work area and open the needed supplies. So first I'm going to open my sterile cleaning solution. So depending on the amount of cleaning needed, the solution might be poured directly over the glass sponges, over a container for small cleaning jobs, or into a basin for more complex or larger cleaning. It just depends on the size of the wound. So I'm going to place on my sterile gloves now. So you can't see me doing this, but I have my non-dominant hand here, and I'm just picking up the cuff of my dominant hand and sliding these gloves on without touching anything. And I want to stay over my sterile field as well. I don't want to touch anything or keep my hands up too high because that would risk them getting contaminated. So now I have my other glove And as you can see, I just slid it on, just like that. And now that I have this glove on, I am allowed to move my other sterile gloves because they are considered sterile. I do want to stay over my sterile field though, which we're going to say is right here. So now I'm going to alternately clean gloves, and that may be used when cleaning a chronic wound or a pressure ulcer. So now I'm going to clean the wound. So I'm going to clean the wound from the top to the bottom and from the center to the outside. So I'm following this pattern. I'm going to use new gauze for each wipe that I do. And this is my gauze here. It's gauze. So I'm going from top to bottom, and I'm going from the center to the outside here. And after each wipe, I'm placing it in the waste receptacle. So now that the wound is clean, I'm going to dry the area using a gauze sponge in the same manner. So this is my gauze sponge. And I'm going top to bottom, and I'm going center to out, center to out. So I'm going to also apply a layer of dry sterile dressing over the wound. So I'm going to use forceps when I'm applying this dressing. I don't have this on me right now, so we're going to pretend like I have the forceps. So if a drain is in use in the wound location, I'm going to clean around the drain as well. I'm going to apply a layer of dry sterile dressing over the wound. Oh, I already said that. So now I'm going to place a second layer of gauze over the wound site as necessary. So I'm going to apply a surgical or abdominal pad, which is my ABD pad, over the gauze at the site of the outermost layer of the dressing as necessary. I'm going to remove and discard my gloves now. Now I'm going to apply tape. So Montgomery straps or roller gauze to secure the dressings. Alternately, many commercial wound products are self-adhesive and do not require additional tape. And so then after securing the dressing, I'm going to label it with a date and time, so that way if there's any confusion that the staff will know at least when it has been changed last and who changed it. So I'm going to remove any extra equipment that I would have on. I'm going to place the patient in a comfortable position, but my patient had already told me that they liked sitting in semi-fowlers, so we're just going to leave them there. Right? You like the position? Okay, great. So now I'm going to put my side rails up and the bed in the lowest position. So I'm going to remove all extra PPE that I had, and I'm going to perform hand hygiene. So it's also important to make sure that we're checking the wounds every shift. So more frequent checks may be needed if the wound is more complex or dressings become saturated quickly. That is the end of skill 31-1.